Hi, my name is Nithya.
I'm Delaney.
I'm Michelle.
And I'm Anjum, and this is our value proposition for a biodegradable zinc implant for intra-articular fractures.
So the current problem that we are looking at is that intra-articular ankle fractures usually need a permanent implant that may need a secondary surgery to be removed. Secondary surgeries have an associated 17% infection risk, and there's an overall a 4% surgical site infection risk during surgery. Secondary surgeries also cause patient expense to increase. So there is a need for the development of advanced biodegradable implants that will minimize complications, infection, and revisions, as well as promote joint function. About 187 per 100,000 adults sustain ankle fractures every year, and of these fractures, 84% of them are intra-articular. So our design aims to limit the potential for infection due to multiple surgeries or external fixation, while also lowering the cost of treatment. The current best practice metallic implants often require secondary surgeries, and this can contribute to joint pain and stiffness. Ideally, there is no need for a secondary surgery with our design and no long-lasting pathology. The target audience we want to reach is medical professionals and patients with intra-articular ankle fractures, which would likely be older patients whose bones are weaker and more likely to get this type of fracture.
For the material and coating of the device, we would use a zinc magnesium calcium alloy for the H plate and screws, as this alloy has been found to promote osteogenic properties and corrosion resistance. The device would also be coated in TCP for osseointegration, implant stability, and further induce bone formation. Additive manufacturing like selective laser melting or 3D printing could be used to manufacture the device. This would allow the device to be customized based on the recipient's skeletal anatomy and defect characteristics to meet the individual needs of the patient. The fabrication process would involve an initial patient imaging and a data model of the implant based on the patient's needs. The zinc alloy would be prepared as the 3D printing or additive manufacturing method will form the molded model. And finishing touches to the device would also include the TCP coating as previously mentioned.
So for our product's benefits and costs, the current best practice for intra-articular implants ranges from $19,000 to $22,000 for uncomplicated replacements. Unfortunately, complications arise and additional replacement surgeries must occur on top of the removal of implants. Our design of zinc biodegradable implants will be more expensive, around 3 to 4 times due to the material. But to the consumer, there will not be an additional surgery cost of replacement or removal. Other than only requiring one surgery, gradual degradation will allow time for healing tissues, and there will be a lower chance of infection due to only having to operate once. Lastly, current practices such as closed reduction and percutaneous pinning or external fixations cause obstructions in life, but our implant design will be completely internal.
Metals, particularly titanium alloys, cobalt chromium alloys, and stainless steel, are commonly used to produce implants for fracture fixation due to their strong mechanical properties. However, these non-biodegradable metal implants have drawbacks, including high stiffness, causing stress shielding and leading to bone resorption. Since these implants do not degrade, secondary surgery is required for removal, which increases the risk of infection. Corrosion byproducts can also be toxic and induce adverse immune responses in the body. This highlights the need for biodegradable metallic implants, like magnesium and zinc alloys. Biodegradable metals offer mechanical advantages over materials like biodegradable polymers, and as they degrade over time, eliminate the need for secondary surgery, reducing infection risks. Zinc alloys with osteoinductive characteristics, good mechanical properties comparable to titanium, and an optimal degradation rate stands out as a better alternative to magnesium. These are our references. Thank you for listening.